Hello everyone and welcome to a new session of hypertension clinical pharmacology question using the Bloom's taxonomy, different level of question, remembering question, understanding, applying, analyzing question, evaluating, and the final step will be creating question. Okay. So the level 1 of Bloom's taxonomy question, which of the following is an angiotensin converting enzyme inhibitor? Losartan, amlodipine, enalapril, hydrochlorothiazide. This is remembering here. Try to recall the fact, definition, and drug properties. Okay. So A, losartan, B, amlodipine, C, enalapril, or D, hydrochlorothiazide. Okay, the correct answer will be enalapril. Someone may ask what is losartan. Losartan belong to the ARBs. Amlodipine belong to the calcium channel blockers. Hydrochlorothiazide belong to the diuretic. So the correct answer will be enalapril belong to the ACE inhibitor. Okay, next level of question. Understanding, comprehension question, interpret the result, explaining information. Why ACE inhibitor? Why do ACE inhibitor often cause a dry cough? Why the patient may suffer from dry cough after using ACE inhibitor? Number one, ACE inhibitor cause bronchoconstriction. B, ACE inhibitor increase sympathetic activity. Or C, ACE inhibitor cause bradykinin accumulation in the lung. Or D, ACE inhibitor cause aldosterone suppression. So the correct answer will be ACE inhibitor increase bradykinin accumulation in the lung, and this will lead to the dry cough. Okay, understand the situation here. Okay, applying the information, we have patient, 65-year-old patient with hypertension and diabetes. So we have two medical cases here in the patients from hypertension and diabetes. Started on antihypertensive medication. Which of the following, which drug provide renal protection in this patient? So we're looking for medication provide renal protection. A, amlodipine, B, furosemide, C, lisinopril, or D, atenolol. Okay, the correct answer will be lisinopril. Lisinopril belong to the ACE inhibitor, and this lisinopril or ACE inhibitor slow progression of diabetic nephropathy. Okay, slow the progression of diabetic nephropathy. Okay, the correct answer will be lisinopril. We try to apply here. We have patient. We try to apply medication to reduce or provide protection or reduce the progression of diabetic nephropathy. Okay, analysis, breakdown, complex clinical cases here. Which combination is most likely to cause significant hyperkalemia in hypertensive patients? Okay, we're looking for the increased level of hyperkalemia. Here we're talking about level of potassium. Which of the following cause significant hyperkalemia in hypertensive patient? Amlodipine hydrochlorothiazide, A. Amlodipine hydrochlorothiazide, B. Atenolol furosemide, C. Lisinopril spironolactone, or D. losartan amlodipine. Okay, the correct answer will be lisinopril and spironolactone. Okay, spironolactone considered like aldosterone antagonist, and when you antagonize the effect of aldosterone, the result will be increased excretion of sodium and water, and decrease excretion of potassium, and this will increase level of potassium in the blood due to the decreased excretion. The same apply here with the lisinopril, belong to the ACE inhibitor, and this present antagonize effect of aldosterone, and follow the same process. So you can see here the correct answer for the significant hyperkalemia will be lisinopril and spironolactone. Regarding evaluation or evaluating, making judgment based on criteria, patient with asthma, patient with asthma, newly diagnosed with hypertension, need pharmacological treatment. Here we have asthma and hypertension. We try to evaluate the case, which drug class should be avoided. So we need to put different, maybe several underline under this word. We need to avoid this medication. Number A, calcium channel blocker. B, thiazide diuretic. C, ACE inhibitor. And D, non-selective beta blocker. So the correct answer we need to avoid in patient with asthma and hypertension will be non-selective beta blocker. For example, here we talk about propranolol. Propranolol black beta 1 and beta 2. Propranolol. Okay, blocking beta 1 and beta 2. Blocking beta 2 will cause bronchoconstriction and aggravate the asthma situation in patient. In this case, it's contraindicated to use it in asthma patient or asthmatic patient. Okay, moving to the creating, synthesis, formulating treatment plan. Here we have developed a treatment strategy for 70 years old hypertensive patients. So we have elderly here, 70-year-old, suffer from hypertension with the isolated systolic blood pressure with no comorbidity. The comorbidity mean no other disease. He is only suffer from hypertension. So treatment strategy, what type of strategy you are going to prescribe or to implement this in this patient? A, prescribe beta blocker immediately. B, begin with a low dose thiazide diuretic. C, start dual therapy with the ACE inhibitor and calcium channel blocker. Or D, recommended lifestyle modification only without medication. So what do you think the correct answer here? Okay, the correct answer will be start with low dose thiazide diuretic. Beta blocker, we don't recommend beta blocker because with the elderly people here, with the aging population, we have decreased heart rate, decreased heart contractility, and beta blocker aggravate the heart function, decrease heart function. We don't recommend to use beta blocker in elderly people. Okay, start with the dual therapy. It's considered like aggressive therapy. To like ACE inhibitor plus calcium channel blocker, we don't recommend to use this one, like 2 medication. Okay, so here the last one, recommended lifestyle modification only without medication. The result because could be associated with the complication of hypertension, isolated hypertension. So we start with the low dose of thiazide. So low dose mean enhanced diuretic, enhanced excretion of sodium, and also cause vasodilation, and this will lead to the decreased blood pressure. So the correct answer will be begin with the low dose thiazide diuretic. This will conclude the hypertension. Okay, the next session we are going to speak about hyperlipidemia, Bloom's taxonomy, clinical pharmacology question. Thank you so much and have a great day.